Illinois health officials announced 42 more deaths today, bringing the total to 141, and 986 new cases, bringing the confirmed cases to 6,980. The virus knows no age limit. Many of today's victims are under 40. Let's get to Tara Molina. She picks up that part of the story. Tara.
Erica, according to CDC data, nearly 40% of people hospitalized right now are under the age of 55. And it's a trend we're seeing right here, too, in Chicago. With nearly half of the people hospitalized, they need treatment within a hospital to recover from this, under the age of 60. 20, 30, 40. They're not the ages we heard about in the beginning, but they describe some of the newest victims of COVID-19 here in Illinois, with more than 70% of cases in Chicago, people 59 and younger. We took questions to Rush Hospital, one of the epicenters in the fight against the coronavirus.
It's affecting everybody.
Jennifer Orozco on its front line.
So I'm the director of advanced practice and responsible for about 400 PAs and nurse practitioners across the system.
She's directing them to help people of all ages.
The statistics are showing it now that this isn't just something that affects older populations, but now we're starting to see it in the younger groups.
Why? She told us because this virus is new. There's no clear answer right now.
We don't know, and I think that's why it's so important that we follow the CDC recommendations and guidelines as best that we can and maintain our social distancing because we don't have a good understanding of who it's going to affect and why some of the groups are being affected that have no problems or pre-existing conditions whatsoever.
She told me the elderly are still considered highest risk because of the outcomes of their cases. Part of the concern with younger groups, they may not have been staying at home and sheltering in place early on. Now, she told me this shows how important that really is for everyone, from infants to the elderly.
I can tell you from someone on the front lines and nurses, PAs, NPs, physicians, we here at Rush, we are thankful when you stay at home. And it really is making a difference and to protect not only you, but also all of us here trying to take care of everybody on the front lines.
Jennifer told me they are working around the clock here at Rush. Many of her coworkers stepping up and working 7 days a week to fight this virus. She says they really appreciate the support they're getting from the community right now, from the public, and people continue to ask what they can do to help. Right now, the answer to that question, just stay home. Reporting live on Rush Medical Center's campus, I'm Tara Molina, CBS 2 News.
Tara, our thanks.